The number is slightly higher in Quebec, but experts say just 1% of Canadians have antibodies to fight the virus that causes COVID-19, and mounting studies show they don't stick around.
If those antibody levels are declining, then that means that the population is not as protected as we thought.
The data hasn't been published yet, but researchers in the UK examined over 17,500 antibody tests. In July, results indicated about 60 in every 1,000 people had detectable antibodies. By September, it was just 44, suggesting the number of people with antibodies had dropped by more than a quarter in just 3 months.
As we would expect, young people tended to keep those antibodies for longer, it seemed, and older people seemed to lose those antibodies quicker.
Canadian scientists conducted a similar study using saliva samples. Results found antibodies did fade, but hung around in the majority of COVID-19 patients for at least 3 months. And while there's a risk of reinfection, cases are still rare.
That's telling us that the immune response is doing exactly what it's supposed to between these antibodies as well as other arms of the immune system.
When a virus enters the body, our immune system creates antibodies to stick to it so the virus can't enter our cells. Other arms of the immune system include natural killer cells that can also recognize and kill off the infection. While the virus can slow down your body's immune response to it, a vaccine can offer your body a preview of the virus before it even arrives.
Vaccines are not held back by those sorts of things. Vaccines can give your immune system a really good kick up the backside and make a very high level of antibody.
Making vaccines the key to safely reaching herd immunity. Christine Birak, CBC News, Toronto.
Okay, now we have epidemiologist Ray Dionanda joining us because can you explain that last part to me? Because don't you have the same problem with vaccine antibodies as you do with natural ones in the sense that they don't stick around for very long?
Well, first of all, in the general population, if you're infected naturally, there's going to be some people who get not a very serious infection, and they're not going to produce as many antibodies, and some people in general don't produce as many antibodies. With a vaccine, we can calibrate the insult such that you produce a large number of antibodies. That's the first thing. Second of all, a vaccine candidate probably has a booster shot built into it to again, produce more antibodies. And third, a vaccine also produces immune response in that second arm of the immune system, the cellular arm, the T cell arm. And all this stuff combines to probably give us a better shot at lasting immunity. But no matter what happens, we'll probably need regular COVID vaccine dosages like the flu vaccine annually or something like that.
Right, because that was going to be my next question. When you raise the idea of booster shots, then is it in fact the case that no matter which vaccine candidate we're looking at, in all likelihood, it will require a shot year after year after year after year?
Yeah, I can't foresee any of the vaccine candidates offering lifetime immunity. I could be wrong, but that doesn't look like the way it's going to go. So the flu, changes regularly, and that requires a different formulation. COVID is going to also mutate, and that'll require not just a different formulation, but also probably additional boosters throughout our lifetime to make sure that we're sufficiently immune.
The new normal. Ray Dionanda, thank you so much.
Thank you.